Welcome to CHEMPLUS, ChemRx's online ordering system. To start, double-click on the ChemPlus icon. The first thing you will see is an option to choose a digital certificate. Just click OK. The next thing it will ask for is your facility code. Your facility code is a 3-digit code assigned to your facility through the pharmacy. For the purposes of this practice, we will use AAA. And then click Next. The next thing it will ask you for is to log in. Click on the username, choose your name, then type in your password. Remember, the password is case sensitive. Then click Login. Once inside, you'll note the resident screen has the residents listed alphabetical. It also shows you their date of birth, station room bed, status, P for pending orders, and next renewal date. Status is color-coded to make it easier to identify. Red discharge means either the resident was sent home, went to the hospital, got admitted, and does not have bed hold, or the resident expired. Green admitted, the resident is here. Added discharge, you'll be returning the resident back to the facility. Blue transferred means the resident is gone to the hospital, got admitted, and has bed hold. Added is going to be for a new resident. An added transfer is for a resident coming back from transfer status. Yellow sent on pass is a resident that's out of the facility for the day. The next column is P for pending orders. Pending orders are orders that have not yet been submitted to the pharmacy. You'll note that next to the added discharge there's a number 18 for patient Augustine August. This resident's coming back from the hospital or back from home, and those are old orders that have been previously stored into the system. Below that, under Betty Boop, is the number 2. These are pending orders for an admitted resident that have not yet been submitted. This means that either PT, OT, dietary, or social work have edited the orders, left them for the nurse or doctor to pick up. Next renewal dates are color-coded as well. Red background means the monthly renewal is late. Yellow background means the monthly renewal is currently due. And white background means the monthly renewal is not yet due. Please note, the doctor will only get a button to allow him to do the monthly renewals if the resident's orders are due or late. Above the area where the residents are located, you'll see 3 tabs: Residents, RX Orders, and Reports. We're currently in the Residents tab. To select a resident, go to Last Name, type in the first few letters of the last name, go across and click Search. When your resident's name appears, click on it or anywhere along that line and it will turn blue. Then click Select. Once you've selected your resident, his name and all the information on that line will appear above the Residents tab. Please make sure the correct resident is on top before you continue on. The next thing we're going to look at are the buttons inside the Residents tab. These buttons appear once the first resident is selected. The Edit Info button is inside is a basic face sheet. This information will be filled out either by admissions or whoever does the new admission. The Discharge button, if someone expires or goes home or gets admitted to the hospital. You can change the discharge date if necessary. any information you may need into the summary portion, and then set the reason. Then click Discharge. And there's your discharge form. If you don't need it, click the X top right hand corner and it puts you back on the main resident screen. If a resident goes to the hospital, gets admitted, and has bed hold, you're going to click the bed hold admission button. Here there are 2 red stars. These are mandatory fields: receiving facility and reason for transfer. Fill out both sections, then click transfer. Do you want to transfer? OK. Resident successfully transferred. OK. Again, if your facility chooses not to use the transfer form, click the X top right hand corner of the screen, and that brings you back to the main resident screen. The next button we're going to review is Send on Pass. If a resident goes out for the day and your facility chooses to use this feature, simply click on the button. Do you want to send selected resident on pass? OK. And as you'll see on the top of the screen, the admission status changes to Send on Pass and is highlighted in yellow. To return back, simply go to the Receive from Pass button located right below the Residents tab and click on it. Do you want to receive selected resident from pass? OK. And the resident comes back into admitted status. Click the OK button. CHEMPLUS also has an electronic progress note. Simply click on the progress note button to enter it. Once inside, the first thing you'll see is current orders with a plus sign and show. Click on the plus sign and it will give you all the orders, all the medication orders. Simply click on the drop down next to each order and click on Controlled, Ineffective, Unknown, or Adverse Effect. If anything needs to be documented, you can type in the free text box directly below the drop down. Once completed, you can go down to the progress note and complete each section. Once complete, you're going to click the Save button. This will store all the information you've just entered, and then click Print. Once you click Print, this will create the progress note for you. This progress note will remain stored until the next progress note is completed. Note, you can only store the most current progress note. When you're done, click Print and then click OK, and this will print the form out for you. When you're finished, hit the X top right hand corner to exit the screen. From here you would click the Residents tab and you'll be back on the main screen. The next button is the immunization record. If your facility chooses, this will be a great way to keep track of all your residents' immunizations. Simply click on the button to enter. And you note at the top it starts with PPD. Click on the top drop down and it has 3 options: yes, no, and other. If you click on yes, you must complete the date, result, lot number, and expiration date. If you click no, you'll be required to put in the date and the reason. If you click in Other, again, you'll be required to put in the date and then free text the reason in the box next to it. Once you're done, click Save. Do you want to save changes? OK. Now you're saved, and you'll note next to the Save button is a Move button. When entering an additional PPD, click the Move button. Do you want to move current record to history? Yes. And that frees up the top section so that you can put in an additional record. And you'll note below the initial record, it's stored under history. If you want to add a different immunization, simply click on the drop down next to Add New Immunization, and you have choices you can choose from. Choose the immunization you want, click Add, and repeat the same steps. When you're done, click the Residence tab on top of the screen, and it brings you back to the main screen. This is the Transfer Form button. If your facility chooses to use this transfer form, simply click on the form. Here you'll either have a drop-down, an area where you have to click in a box to make a choice, or an area that requires free text. Complete the form, go to the bottom of the screen, and click Print. This will produce a transfer form. This will contain all the information you've just filled out, plus any information that's in the Edit Info form, including prescriber name, allergy diagnosis, and any immunizations that are in the record. The second part of this form contains all the orders, drug and non-drug. Simply click Print, click OK, and print the form. When done, go back to the residence screen. When done, go back to the residence screen. Pending orders. There are a few different ways to check for pending orders. First, click on Station, choose your unit, click in the box below the P for pending orders to create a check mark, then click Search. If any resident appears on the list below, click on that row, then click Select. The resident's name will appear on the top of the screen. Then you will click RX Orders. Once inside, you will go down to You Have Pending Orders and click View. Once inside, you will note that there are two diet orders, a discontinued order and a new order. You can tell who put the order in by looking at the Entered By below each order. Call the doctor, verify the order with him or her, then click on the check mark next to Pending Orders to highlight. You'll note now that both orders have changed colors. You can now click the Submit button and the order will be transmitted to the pharmacist. A box will then appear stating resident name and orders checked and confirmed. Do you want to submit select pending orders for resident Betty Boop located at 63B? Click OK. This is your final check that the orders are correct and for the right resident. Then click OK, and this will print the form for you. This will create a telephone order. After you print the order, You will sign where it says picked by, put in the date and time, and flag it for the doctor, or use whatever procedure your facility currently uses. When done, click the X on the top right hand corner of the screen to get out of that screen. Another way to check for pending orders is to go into Reports and go to Station Report. Go to Station and choose your unit. Then click Run. Not only will you get pending orders, but you'll also be able to see any recent new admissions, readmissions, on-pass, hospitalizations, discharges, or monthly renewals. You can print a copy of this form by simply clicking the Print button, top left-hand corner of the screen, and then click OK. Telephone or interim orders. Once you have the resident on top of the screen, go to RX Orders. Here you will have two choices, Order Type and View Current. Anytime you're doing a brand new order, you're going to go into Order Type by clicking on the drop-down box and choosing the order you want to do. You have regular drug, drug treatment, IV and finger sticks, and a list of non-drug orders below. Please note that drug treatments include creams, topicals, and ointments and cannot be found under regular drugs. Regular drugs such as pills, eardrops, eye drops, or suppositories, injectables, or liquids can only be found under regular drug. Whenever you want to change or DC an order, you're going to go into View Current Orders. You'll note that each order has an Edit button on the top right hand corner. Any order can be edited or DC'd. To edit an order, simply click on the Edit button and you'll come to the regular drug screen. Make the change you want to make and then save at the bottom of the screen. Inside current orders, you have two columns, drug orders on the left, non-drug orders on the right. You will note now that any treatment orders will now show up on the left-hand side under drug orders. Each order has an edit button, whether it's drug or non-drug. We're going to start by changing a drug order. Simply click on the edit button and it'll take you to the drug order screen. Make the change you want to make, then click Save. This order will now go into pending. Pending is the last stop before all orders are to be submitted. You will note there are now two orders created. The first order is a discontinue of the Abilify. The second order is the change that was made to the Abilify. Simply click in the checkbox next to pending orders to highlight, then click Submit. Click OK, and your order has been created. Click OK to print, and the order will print out. Make the change on the MAR, sign the order, and flag it for the doctor. When you're done, hit the red X top right hand corner, and that will take you out of the print page. If you have more orders to do, leave those orders in pending and go back to RX orders. Now we're going to delete or DC an order. Click on View Current Go down to the orders you want to DC and click on them anywhere in the box. You can DC as many orders as you need to by simply clicking inside the box. When you're done, click the DC button. Do you want to DC selected orders? OK. And those orders go into pending. All these orders will stay here indefinitely. They must be manually transmitted for them to be submitted. The next thing we're going to do is we're going to do a brand new order. We're going to go to RX orders, order type, and we're going to do a regular drug. Click on regular drug, click add, and here's our order form. We're going to look for Lasix. So type in the first few letters of the medicine you're looking for and click search. Find the medicine you're looking for. Make sure you have the correct dosage and form. Click on it to highlight it, then click select. If a pop-up or an alert comes up on the screen, look at it and make sure that it does or does not pertain to your medicine. In this case, it's saying drug Lasix 20 milligrams has following alert: look-alike, sound-alike medication. Do you want to select it? And we're going to say OK. Anywhere inside this order where there's a red star, information must be put into the order, otherwise you will not be able to submit it. So start from the top, work your way down. Units per dose, we want 1 tablet. Route by mouth. Frequency 1 time a day. Auxiliary. This is to be used if you specifically want it as needed or a particular time before or after meal. In this case, we're going to leave it blank. And we're going to continue on with diagnosis. Click on the add button. And sometimes it'll give you just a limited choice, sometimes it'll give you all the choices. In this case, we're going to choose CHF and add. Now we're going to do another order, so we're going to go down to the bottom where it says add and add new, and we're going to click on that. What that does is send the order to pending and set you up again to do another order right away. Next thing we're going to do is we're going to add a liquid. Now we're going to do Maalox. Type in the first few letters, click search, find the appropriate medicine, and click select. Units per dose. Now instead of clicking on the drop down, we're going to go to the right and we're going to type in the number of units we want. In this case, we want 30 mLs. So here we're just going to type in 30, go down to drug form, and put in mLs, and then complete the order. Route by mouth, frequency twice a day, auxiliary, PRN, or as needed, and diagnosis. In this case, we're just going to choose abdominal pain. Here you see we have 105 pages of choices, and we're just going to click on abdominal pain, choose that. At the bottom of the screen, at the bottom of the order, is the other category. Order valid for 30 days, less amount of days is specified. You're only going to put an amount of days in here if this is a short-term medication. In this case it is. The doctor only wants it ordered for 7 days. So we're going to click on 7 days or 1 week and then click add. This being the last order we're doing for this resident, the add button will take us into pending. Here we can review our orders to make sure they're correct, and they are. So we're going to click on the checkbox next to pending orders to highlight everything. Go down to the bottom of the screen and we're going to submit. Do you want to submit for this resident? Yes, we do. Click OK. And there's our order. It has already been transmitted to the pharmacy. Click OK. Just print the order sign it, date it, put the time on it, flag it for the doctor, then make any changes to the MAR manually. Click the X top right hand corner to get out of the screen, and it puts you back into the order section. Ordering IVs. Once the resident is on top of the screen, go to the RX Orders tab, go down to Order Type, and click on IV. Then click Add. Here you will find the IV order form. Start from the top, work your way down, noting that you must put information in any area that has a red star. Height and weight are not required, but if you have that information, that would be helpful. IV access, if you click on the drop down, you'll have your options. Let's click on peripheral, and then we can choose butterfly, heplock, medlock, midline. We're going to go with heplock. Is resident diabetic? Yes or no. Electrolyte imbalance? Yes or no. Hypertensive? Yes or no. Fluid restrictions? Yes or no. Once that's done, we're going to go to please choose therapy. Click on the drop down and it gives you options: antibiotic and other drug therapy or hydration. We'll start with antibiotic and other drug therapy. Click in the drug box. You'll get a drop down and start typing the first few letters of the drug you're looking for. We'll type in CIP for Cipro and click search. Choose the appropriate dosage. We'll go with 400 milligrams and then click select. Strength, we're going to type in 400 milligrams. Frequency, every 12 hours. And number of days, we're going to put 7. Diagnosis, we're going to click the add button and type in our diagnosis to search. Again, here we only need the first few letters of the diagnosis. So I'm going to type in UTI and click search. That's UTI is what we're looking for. We're going to click on it, click add, and continue on. Flushes are next. They're mandatory. You can choose either heparin, normal saline, or both. And complete the blank boxes. Complete the free text boxes. And then you can go down to other. Order valid for 30 days, less amount of days specified. Again, 7 days. After we complete the number of days, we're going to go back to the add button next to the drug, and we're going to click on it. And what that's going to do is store the order and allow you to put 2 more IV drugs into the same order. This will avoid repeating the previous steps. So we're going to go with Zosyn, 3.375 grams. Select, again, strength, 3.375 grams. Frequency, every 12 hours. And number of days, 7. Diagnosis, we're going to click in the add box. Diagnosis, we're going to click in the add button. Type in the first few letters of our diagnosis, which is UTI, and search. Click on the UTI and then click add. Now we're going to click the add button, and that's going to store 2 orders for us. We're done. We're going to go to the bottom of the screen and we're going to click add. This takes us to pending, where you can see the order is complete and ready to go. To enter a finger stick with or without coverage, click on order type and click on finger stick blood sugar. Then click add. Start from the top. Frequency is required. Click on the drop down box, and we're going to go to 4 times a day, AC and HS. We're going to click on name, and we're going to click on the Humalog Quick Pen. Then click select. We're going to click on the box next to with coverage. Once we do that, if your facility has a protocol, it'll appear on the right hand side. If you're going to use one of the protocols, click in the drop down, choose the protocol you want, then click set. And this will set up your coverage for you. If you don't want to use coverage, or if you don't have coverage, or if you don't have protocol, click on coverage. If you don't have a protocol, or if you don't, or you can't use the protocol that's already been preset, click on the plus sign next to if reading, and that will open up boxes for you to put the data in. Click it as many times as you need, and then start typing. So between 150 and 200, we're going to give 2 units. 201 to 250, 4 units. 251 to 300, 6 units. 301 to 350, 8 units. And you can see we still need more boxes, so we're going to click the plus sign a couple more times. 351 to 400, 10 units. The next part of the order is going to read over 400, give 12 units. And the way we're going to write that is we're going to type in 400, leave the and blank, go to give and type in 12. Then we're going to complete above and below, so above 400 or below 60, call MD. Diagnosis, we're going to type in DM, or diabetes mellitus, and we're going to click the add button at the bottom of the screen. By leaving that AND box blank, when the order goes into pending, it's going to go, instead of reading between 400 and blank give 12 units, it's going to say above 400 give 12 units. And there it is right there, above 400 give 12 units. Non-drug orders. There are many different types of non-drug orders. They can be customized to suit the needs of your facility. Let's look at a few. One-time lab and one-time consults. These are orders that will DC after they have been submitted into the system. You will be able to print out the order. You'll also have routine labs and routine consults. These orders will stay in effect until you DC them, or if you go into order valid for 30 days section, or put in the number of days you want the orders to last. Diagnostics, hold medication, and emergency room transfer are also one-time orders. These orders will DC from the system as soon as they are submitted. Let's look inside emergency room transfer. Click on emergency room transfer, then click the add button to the right. Simply go into the drop down next to hospital, search for the hospital you're sending the resident to. Below, click and type in the reason. And then add. Then click the add button at the bottom of the screen. Click on the order to highlight it, then submit. One-time labs. Click on the order. Click on the order type you want, then click add. Click in the drop down. Choose the first lab that you want to do. And click the add button. If you have other labs you need to do, go back to the drop down. Click on the lab you want and click add. If you want to add a date or a time to do the order, click in the lab choice drop down, choose your lab, then go to the free text box below, type in when you want the order to be done, then click add. When you're done, click the add button at the bottom of the screen. Again, the one-time labs will DC after they've been submitted. Let's leave this order here and go back and do a routine consult. Find routine consult, click on it, and click add. Again, we can use the drop down and choose as many consults as we need. Let's choose dental care yearly and follow-up is needed. Click the add button, and let's do one more. ENT consult and follow-up is needed. Click on the order, click the add button. Now we don't need to use frequency because it already has follow-up. It already has yearly and follow-up, or follow-up is needed. When you're done, click the add button at the bottom of the order. The order will go into pending. We will now submit both of these orders. Click on the check mark next to pending orders. This highlights the orders. Review them, make sure you have the right resident, and click submit. Resident name and orders checked to confirm. Do you want to submit? Yes, we do. Readmission from discharge status. After you've logged in, you'll need to search for the resident by clicking in the last name box, typing in the first few letters of the last name of the resident, and click search. We found our resident. We're going to click on the line and then click select. This puts the resident on top of the screen. It also opens up a couple of buttons below the Residents tab. We're going to go to the Add Discharge button and click on that. Do you want to add selected resident? OK. And we've successfully added the resident. Please note the resident must be in discharge or transferred status in order to do a readmission. Once we change the status from discharge to added discharge, we're going to click on RX orders, click on the default drop down, and go down to readmission. If your facility has a readmission protocol, it will be here. Now click add. Click OK and OK. Now the resident is in added discharge status with all of his or hers previous orders, as well as the readmission protocol orders. You're going to review the orders with the doctor, make any changes you need to the system, and then submit the orders. Prior to submitting the order, you must make sure that the resident is in a bed. To do that, go to the bottom of the screen that says you cannot submit orders, resident is not valid, resident location is missing. Click the edit button and this will take you to the edit info page. Click on the down arrow to the right of bed, look for the bed combination you need, click on it, click select, and then save it at the bottom of the screen. Do you want to save OK? OK. Then go to RX orders, view pending, now you're ready to make changes and to submit the orders. To continue, please see Edit Orders and Submit Pending Orders section. Next, we're going to do a readmission from transfer status. After you log in, go to last name, type in the first few letters of the last name of the resident you're looking for, and go across to search and click search. Once you locate your resident, click on the line with the resident's name in it. It'll turn blue, then click select. The name will now appear on top of the screen. Below the Residents tab, you'll see a button that says Receive Transferred. Click on it. Click OK. Do you want to receive? Yes, we do. And the resident has been successfully received. Click OK. Now he's changed from transferred to added transferred. Next thing we're going to do is we're going to go to RX orders. We're going to go to the drop down that says default in it. Click on it. Go to readmission and add. Once inside, we're going to go and check the orders. We're going to delete anything that we no longer need by clicking inside the box to highlight the order, and then click delete at the bottom of the screen. We checked there are no red marks inside the orders. We can now continue making changes to the orders and then submit the orders. Please see Edit Orders and Submit Pending Orders to complete this section. Submitted orders, admission, readmission. Once the orders are complete and have been verified by the doctor, click on the checkbox next to Pending Admission Orders to highlight all the orders. Go to the bottom of the screen and click Submit. This is your last check here. Just make sure the resident's name is correct and you've verified the orders. Click OK to submit. This will produce your admission. After you've printed out the form, go to the bottom of the form and sign it, date it, and time it. You will then need to complete the MAR and TAR. To exit this screen, hit the X top right hand corner. Reports, MAR and TAR. After a resident has been admitted, readmitted, or the monthly renewal has been completed by the doctor and signed, you will then have to print out a MAR and TAR. Once you've logged in and put the resident's name on the top of the screen, go to Reports. From here you click on MAR-TAR, set the date for the cycle date, then click MAR Run. On the top right hand side of the MAR and TAR, it'll tell you how many pages of laser printer paper you will need. Put in the appropriate number of pages into the printer and then click Print. Click Print again and this will print out your MAR for you. Please note that the MAR will not print out in color unless you have a color printer. When done, click the red X top right hand corner. Once done, go back in and click TAR Report Run and complete the same process. Load in 2 pages of TAR paper, click Print, and print out your TAR. Hit the X top right hand corner. To print a blank MAR or TAR, go into the MAR-TAR section, reset the cycle date to the start of that resident's cycle, click Print Blank, and then run either the MAR or TAR. This will give you a blank form that you can print out, handwrite any new orders. To exit, hit the X top right hand corner. Monthly renewals. This report can be run a couple times a week. Click on monthly renewals. Click on station to choose your unit. Then click Run. Leave the dates blank and this will give you the most current report, including any monthlies that may have been missed. You can print this report by clicking on the Print button top left hand corner of the screen and click Print again. When done, click on the X top right hand corner. This report can also be run by prescriber. Simply go to the drop down next to prescriber, choose the prescriber, and click Run. This will give you a report of any monthlies for that prescriber in the building. To print this report, click Print top left hand corner, print again at the bottom of the box, and to exit, click on the X top right hand corner. Resident roster. Resident roster can be run by station, by room, prescriber, or provider. It can be sorted by resident's name, resident status alphabetical, or by room number, prescriber. Select your unit by going to station. And if that's the only criteria you want, you can click Run. To run this report using resident allergies and diagnosis, start by clicking your unit in the station box. Click the checkbox next to Add Resident Allergies and Diagnosis and Run. Search orders. I repeat, search orders. You can search orders by resident, by unit, by prescriber, or by the type of order. You can search either current, pending, or discontinued orders. To start, let's click on All Residents, order type. No, let's show them the different ones. Unclick, yeah, just, yeah. All right. Let's do it. Okay. To search orders, you can search by date, all residents, an individual unit, prescriber, individual resident. You can search by current, pending, or discontinued orders. And you can search by order type. Regular drug, drug treatment, IV, finger sticks, or any non-drug order located in the RX order section under order type. To start, we'll click on All Residents. We'll keep regular drug and we'll type in Lasix. You only need the first few letters of the word and then click Run. This will prepare a report for anybody in the building that's on Lasix at this time. You can print this report by clicking Print and then Print again. Exit by clicking in the X top right hand corner of the screen. You'll note while inside regular drug, you can look up specifically the drug, units per dose, drug form, drug route, frequency, auxiliary, diagnosis, instructions, supplement directions, or day's quantity. If you're working on a unit for the first time or relatively new to the unit and you want to know who has finger sticks on your unit, start by clicking on your unit, keep search current orders, click on regular drug, and go down the finger stick. Then Run. This will give you a report of anyone on your unit with a finger stick. Submitted orders. To look up an order that has already been submitted, you can go to the top row and search by order number, submit date, category, resident last name, first name, station or unit, primary prescriber's name, or the submitted user's name. For the purpose of this training, we'll go to resident's last name and type in C-O-R-T for Cortland and click search. You will notice we have 3 pages of orders for this resident. The submitted date is done chronologically, starting with the most current order. Find the order you want, click on it, then click Print. And there's your order ready to be printed out. Simply click print, top left hand corner, and then when the box opens up, click print again. When you're done, hit the X top right hand corner.